Hi, emergency physicians and future emergency physicians at East Carolina University. I'm Julia Alencar. I'm a proud Brazilian emergency physician at São Paulo University. And today we talk about a little bit about emergency medicine in Brazil. First of all, I need to say apologize. I'm not a native English speaker, neither I'm fluent in English actually, so you might have some difficulty to understand the language I'm speaking now. If you have any questions and any troubles or want to get in touch with me, this is my email in this slide. So let's go. A little bit of geography. Brazil is a country of nearly 200 million of people with a territorial area similar to USA. Although we are the 80th economy at world, sorry Italians, we have a much of poverty and social inequality. Our country is divided to 27 states and 5 big regions. So our famous green and yellow flag have 27 stars, not 50 like yours. Emergency medicine is the newest medical specialty in Brazil. We only become a recognized specialty in 2017, and only then we could have residence training programs and teaching emergency medicine at school, at universities for undergraduations and postgraduations levels, for example. Before that, there were only 2 centers that trained emergency physicians in the country. Actually, there was a 3 years training program, but in the end, we did have any certification. On these programs was in Ceará. Ceará, Ceará was the state that I was born, and Ceará is the most beautiful state in Brazil, but the poorest state too. So we have paradisical beaches on the coast and much hunger and poverty in the interior, which is an arid desert, for example. Emergency physicians treat many infectious diseases, and I think the most important infectious disease is dengue fever. So if you look this image, the dengue fever, the risky areas, it's the tropical areas, and Ceará, it's the most important state, I think, in Brazil and in the world for this disease. The symptoms of dengue fever was no much rash and no much nausea and vomit. The most important symptom, the dengue fever, is fever. So if you visit Ceará, please bring repellent. But if you forget the repellent and feel fever 4 or 5 days before your visit, please think about dengue. The symptoms are fever, of course, and myalgia, arthralgia, eye pain, headache, nausea, and vomit. In the more severe case, the disease can progress to hemorrhagic phenomena and a distributive shock to increase capillary permeability. The treatment is supportive with hydration, the most important way to the severe patient, and blood productions and patients with bleeding, for example. And time. We need some patient to treat the patient, for example. This year, 2024, we published 2 important articles about dengue, in the Brazilian Journal of Emergency Medicine. The first was the FAST or eFast. The eFast is a joke with a fast, of course, and this is a protocol called Extended Focused Assessment Sonography in Dengue. In this protocol, we insert with the POCUS some fluids in CTs, for example, or pleuric fusion. So this is the protocol, and when you're looking for and we find some cavitary leakage, this patient is more severe than others. The second important article was the clinical guidelines for treat patients with dengue, and mild cases and more severe cases. So if you can read this protocol, it's very good, I think, and you can read the QR code, and the protocol was in English. So I have some difficulty to read, but works. I think the second important disease for emergency physicians visiting Brazil was leishmaniasis. Leishmaniasis is another disease. The mosquito is very important in the circle of the disease, and leishmaniasis has three forms: the cutaneous forms with this eruption and the skin, the visceral form with fever and affects internal organs like liver and spleen, and the mucosal form, more hard form of leishmaniasis. So this is a more severe disease and a subacute disease with fever and loss of wave and hepatomegaly and maybe a disease in the bone marrow. Well, I finished my training program in Ceará, and I moved to São Paulo for finish my PhD and my training in emergency medicine. And nowadays I live in São Paulo state, and São Paulo where the state where I currently work as emergency physician and professor, emergency medicine professor at São Paulo University. São Paulo is the rich, I don't know, the more money state, the richest state, and most populous state in Brazil. The city of São Paulo has, I think, 12 million of people, and the Hospital das Clínicas da Universidade de São Paulo, the HC or HC in Portuguese, has 2,000 beds, and it is the largest Latin American hospital. So I think here we attend a little bit of every emergency disease, but the most of the cases we attend the stroke and the heart attack and pneumonia and cardiac overload. I think it's more similar than USA. The patients and the emergency patients here, but we have a second huge problem in São Paulo, and this is the urban violence. So we have trafficking of drugs, and it's not hard gunshots or accidents for populations here, and emergency physicians must be prepared to attend either the cardiovascular disease and pneumonia, but to the gunshots, for example, and the car accidents. like the big cities and like the Latin American big cities. A couple of years ago, we have, for example, looks like Columbine in USA. We have gunshot problems in school, and we attended the children's in HC, and happily it's not an unusual problem. It's really an usual problem here, and this is a big problem of our country. So I live in São Paulo, but I work too in Amazonas. uh, we have in the green, the north region, the big region, the north, and this region, uh, in there is an Amazonas rainforest. So I think it's the most famous rainforest in the world, and it's a very beautiful place and a very nice place to work like emergency physician. So I I visit Amazonia twice a year, and I love that. We use a boat, so we have a couple of sea, but we have so many rivers. So the in the rainforest you use boats, and we don't have, for example, ambulances by car, but the boat ambulance on the right we have a boat ambulance. Very it's very nice to drive a boat ambulance actually, and you can transfer patients from the rainforest into the hospital with the boat ambulance. So here we attend to, like, looks like a rural medicine, I think, and it's a little bit of all the diseases. So uh, uh, we don't have so much dengue fever or leishmaniasis or gunshots, for example, but we have so many children with a cold, a flu, and adults with skin disease, many dermatological disease, and we have a very important infectious disease that is malaria. So if you visit Amazonia and some patient have fever, please think about malaria. And malaria is another disease transmitted by mosquito, another mosquito. We have so many mosquitoes here, so please bring repellent if you visit Brazil. And the patient have fever and hemolytic anemia and liver disease, and this liver disease can progress to liver insufficiency, acute liver insufficiency, and can progress to cerebral edema and increased intracranial pressure or herniation, for example. So all these diseases have a specific treatment. So we have three forms of malaria in Brazil, and we have treatment for all. Uh, well, I confess that I was not the first person that Alex contacted in Brazil to give this lecture. Of course, my English is terrible, so the first choice was a colleague, my best friend called Lucas Silva, and Lucas Silva is an emergency physician at Rio Grande do Sul, RS, in the south uh, region in Brazil. He unfortunately, and he could not give this lecture because the states has been greatly affected by the climatic crisis in Brazil in this moment. Right now, emergency physicians are dealing with the overcrowded emergency department and diseases uh, like leptospirosis, for example. So this is the airport Porto Alegre, the capital of the state of Rio Grande do Sul, and the city was completely flooded because of the rains. So leptospirosis, it's not a usual disease in Brazil, but in this moment it's a worry for us because the flood in Rio Grande do Sul. And the disease, well, we have high fever, you can progress to VU form and the immune form with red eye, cutaneous rash, chili, and we treat the disease in the septic phase with ceftriaxone. We can use it a little bit ceftriaxone in the second phase too, and it's supporting for dysfunction, like if the patient has a kidney injury, the dialysis or respiratory insufficiency or alveolar hemorrhagia, we can intubate the patient, for example. So we have the fifth region in the Midwest. This region is the agribusiness on the country, and and there there are Brasilia. Brasilia is currently the capital of the Brazil. The capital of Brazil, it's not Rio, it's Brasilia in the Midwest. Okay, I think this region it's less population, and we don't have some important diseases there. So it's a rich region too, and I think it's similar to São Paulo, for example. Well, that's all I had to say in this introductory lecture. To learn more about Brazil, please write to me. I will be very happy to talk to you about the emergency medicine in Brazil. I talked about the emergency physicians day, I think, but I think we do so many more things like research, like class. I'm professor at university now, so emergency physician it's a very important career in Brazil in this moment. So best regards, and I hope we will see you soon. Bye bye.